data is one of the hardest things to gather, especially as you're looking at new problems. Trying to find the sources of the data, making sure it's accurate, pulling it all together has absolutely been a challenge. And I think it's a challenge of most organizations. So where we really focus is how can we pull the right people into the room. We've got an amazing IT department. How do we find those sources of data, whether they exist in systems, pulling them out of the systems, or even going into a manual process that becomes automated later on to be able to move the needle that we need to and gather the information.
It's critically important to have data, to have the right data to drive improvement. But that right word is really hard. You want information that gives them feedback as to how they're doing and how to correct it. I'll often go up to a group of clinicians and say, what data do you have? And they'll tell me the data that they have. And I said, which of those data sets are actionable on your part? And that might be a subset of the data they have. And then I said, then why are you spending any effort at all on data that's not actionable? And it's amazing where that takes their head as far as what to do and what not to. And then I asked a wicked question. I said, of that data that's actionable, which of that data have you been taking action on? And then I asked them, for that data that's actionable that you haven't worked on, why not? And what you try to get them to is, only spend your efforts on actionable data that you have the capacity or resources to take action on. Stop spending your time on the rest of it.
The challenge with the data is understanding what data you need to collect, and I think the data can go at a lot of levels. So we can pull stuff out of our EMR, for example. We can look at trends, we can look at more global numbers. But the fact is, when we're looking at performance improvement at a process level, that can just be manual. I mean, it's literally like tick marks that we can make. How many times does this happen every day? Well, it's 15. Or we do, we call it issues and occurrences list, which is basically building a Pareto chart that says, where's the issue at? And it's literally a manual system, and anybody can do that. But it makes it very visual for staff to understand, like, this is our root cause problem, let's go fix that. So I think we can overthink sometimes the data and how we get it, or we expect some machine to deliver it for us, when the fact is we can just, have sticky notes and whatever, and make some tick marks to get some solutions moving forward.
Data collection is really important in the whole quality space. You have to be able to make sure you're making an appreciable difference, that all that work was worth it for something, that you're making a meaningful contribution. I think a rural or a small provider might have a little bit of a unique challenge in that you don't have some of those law of large numbers where you can really scale things across a wide patient population. Sometimes you have some data anomalies that happen when you only have a handful of cases of any specific item, in the course of a year. If you miss one of them, your score drops to 80%, and that can look like a really significant change when it might have been just one specific case. So I think it's a little bit of managing some of the expectations with what the data is telling you, looking at the actual number of instances and number of patients who are affected by it, and just understanding that there are some limitations to data when you're working with smaller numbers.